Hi, welcome back to Medicare Mondays. Today's session is being pre-recorded. Today's session is about Medicare and immigration status. Do you qualify for federal disability or retirement benefits? Did you know that you don't have to be a U.S. citizen to be eligible for Medicare? Between the growing number of older immigrants in the U.S. and the unique hurdles they face enrolling into Medicare, Medicare and immigration is an important topic to discuss. If you are not a U.S. citizen but are lawfully present, you may be able to get Medicare coverage, depending on your situation. Some of those situations are if you collect Social Security retirement benefits, railroad retirement benefits, or Social Security disability insurance. If you're eligible and ready to enroll, or you have questions about Medicare eligibility and enrollment, you should contact Social Security. Their national helpline is 1-888-772-1213, or you can go to www.ssa.gov to visit your local branch to enroll. Are you a lawfully permanent resident who has lived in the U.S. for 5 or more years? Here's some of the situations that you can compare yourself to. Lawfully permanent residents are non-citizens who are allowed to live in the U.S. indefinitely. To be a lawfully permanent resident status, and you must apply for a green card through the U.S. Citizenship and Immigration Service. 5-year residency requirements begin the day someone arrives in the U.S. with the intentions of establishing a home, not just visiting. You can still leave the U.S. temporarily, meaning for no more than 6 months. Use the National Immigration Legal Service Directory to find immigration service providers in your area. Find out more at the following web link: www.immigrationadvocates.org/legal directory/. How do I know if I owe a Part A premium as a non-citizen? Some of the things that you want to consider are: to qualify for a premium-free Part A, you must be considered fully insured by the Social Security Administration. To be considered fully insured at the age of 65, you, or in some situations, your spouse, must have worked at least 40 calendar quarters or 10 years in a job where Social Security taxes were paid. For people under age 65, the number of calendar quarters of Social Security credit needed varies based on the age of onset of disability and when those work quarters occurred. Most people who are considered fully insured also qualify for Social Security retirement or railroad retirement benefits. If you are fully insured, you are eligible for premium-free Part A, and you are eligible for Medicare without regards to where you have lived for the past 5 years. If you are not fully insured and you must pay a premium for Part A, you are only eligible to enroll in Medicare if you are a legally permanent resident and you have lived in the U.S. continuously for the 5 years prior to enrolling into Medicare. If you are under age 65 and eligible for Medicare due to receiving Social Security disability insurance for 24 months through either end-stage renal disease or receiving Social Security disability and have ALS, you are considered fully insured and you are eligible for premium Part A. If you aren't sure if you qualify for premium-free Part A, you can call the Social Security Administration at 1-800-772-1213. Alternatively, you can create my Social Security account at www.ssa.gov to view your work history and benefit eligibility. How can I get assistance with Medicare premiums? This program is called Medicare Savings Programs. If you enroll into an MSP, you will no longer owe the Part B program, even if you qualify for certain levels of MSP called the Qualified Beneficiary Medicare beneficiary. You will also not owe the Part A premium if you have one. To qualify for the MSE programs, you must have Medicare Part A and meet an income and asset guideline. Some of the things you want to consider enrolling into a qualified Medicare beneficiary is you state you have a process to allow you to enroll into Part A and QIMBY. Many states allow this through the year, but others limit it when you can enroll into Part A. Income and asset guidelines vary by state, and some states do not count assets when determining MSP. Medicaid programs, including MSPs, have their own immigration status and residency requirements. That may not be eligible due to these restrictions. Some states provide Medicaid benefits, including MSP, for people who do not meet the federal requirement using the state funds. Contact your state health insurance program to learn about the Medicare Savings Program eligibility in your state. The number you should call is 1-888-884-8721. Extra Help is another program that you could look into. It is also called LIS, Low Income Subsidy. It pays for your Part D premiums up to a state-specific benchmark amount and lowers the cost of your prescription drugs. You can apply through Social Security Administration or contact your SHIP to help apply. There are no additional immigration or lengths of residency requirements for Extra Help. Where else can I get health coverage if I'm not a U.S. citizen and don't qualify for Medicare? Well, a couple of places are. One is marketplace coverage. There is no length of residency requirements for marketplace coverage, or the tax credits and cost share reductions that can make marketplace plans more affordable. So legal permanent resident may qualify for marketplace coverage. Even if someone does qualify for Medicare, but not for the premium-free Part A, they may find it more affordable for them to enroll into the marketplace rather than Medicare. To learn more about marketplace coverage, go to www.healthcare.gov or call 1-800-318-2596 or contact your state marketplace in the state that you live in. Rhode Island has a marketplace named HealthSource Rhode Island. That number is 1-855-84-4774. You could also review to see if you qualify for Medicaid. Most non-citizens must meet a 5-year residency requirement for Medicaid coverage, but not all. Each state's eligibility for the Medicaid program differ. For example, states can remove the length of residency requirements or legal permanent residence for pregnant people or children, or provide additional coverage using only state funds. If you aren't lawfully present in the country, including if you are undocumented, you still get Medicaid coverage for emergency care. To learn more about your state's Medicaid program, contact your local Medicaid agency. Rhode Island's Medicaid agency is 1-855-697-4347. Something to be aware of is if you are enrolled into Medicare, be aware of people trying to steal your Medicare number. Medical identity theft happens when somebody steals your personal information and uses it to get medical treatment or equipment and bills your insurance for it. Healthcare companies can try to reach people in various ways, like television commercials, radio ads, events, mailings, phone calls, text messages. Some of them may be legitimate, but some could potentially be scammers trying to steal your personal information or medical identity information. Steps to prevent healthcare fraud: protect your Medicare and/or health ID numbers, and only share it with your healthcare providers or trusted persons. Protect your Medicare card like you would a credit card. Scammers have various ways of stealing someone's Medicare number or other personal information. Detect medical identity theft by reading your Medicare statements often. If you see services or prescriptions that you did not know about or receive, your Medicare and/or healthcare ID number could be considered compromised. Report potential medical identity theft to your local SMP. It can affect your medical and health insurance records and your ability to receive services or equipment in the future when it is medically needed. It can also lead to incorrect costs for both you and the Medicare program. Contact the Rhode Island SMP at 1-888-884-8721. If you need further assistance with your Medicare options or other healthcare options, contact any one of our community partners listed here. They are Aging Well, Johnston Senior Center, West Bay Community Action Agency, South Kingstown Senior Center, Westerly Senior Center, The Point, our Aging and Disability Resource Center, East Bay Community Action Agency, Leon Matthews Senior Center, Progreso Latino, Child and Family Services of Newport County, Edward King House, and of course we have our main Rhode Island SHIP and SMP line. Thank you for viewing our program. If you have further questions, you can always reach out to us. My name is Kim Timpson, and along with my colleague Jennifer Riaz, we help oversee the SHIP and SMP program.